Here's Stacy somewhere in Georgia. Great to have you with us on the EIB network. Hi.
Ditto's Rush.
Thank you.
Hiding under a tree, hoping I won't be seen. I wanted to talk with you about how the government or how Obama is going to do that thing about quality versus quantity.
Yeah, and the bundling of payments.
Yes, and I also wanted to say, I'll say it for you, Obama's a liar. There is no such thing as pre-existing condition exclusions for life. So, sorry, no better. You can't pull that one off on me.
What do you mean? Wait a minute. Translate that for people in the audience. There's no such thing as permanent exclusions on pre-existing conditions for life. What does that mean?
That is true. Anyone who signs on to a group policy, which is 90% of all insured, sign on under the HIPAA law from 96. The maximum waiting period for pre-existing conditions is 1 year. That 1 year is reduced by the number of months in the previous calendar year you had coverage. For example, if you work for a company and you have insurance there, you change jobs, go to a different company, every pre-existing condition you have is covered with a certificate of credible coverage from your previous insurance company. So Obama can't pull that one on me. I know he's a liar.
I have to ask you how you know this.
I work in insurance, which is why I'm hiding under a tree behind a car, hoping nobody sees me.
That's what I would hope you would say. I wanted to make sure that you had credibility to know what it is that you're saying and discussing.
Well, sir, I'm a business systems analyst on a claim system, a medical claim system, so I'm very familiar with it.
And you are, at this very moment, making this phone call hiding under the shade of a tree.
In the parking lot, yes, sir. Yeah. Well, and I also want to talk about how Obama's going to do this, and I can't claim all the credit for this thought. This morning I saw on the news someone talking about capitation, and that sounds exactly like what they are going to do. Capitation is where the doctor does not get paid by visits or procedures. Capitation is a primary care physician payment where they pay you per person you treat in a month. So if you have 50 patients, you get paid X number of dollars for each patient.
Okay, hang on. I got to take commercial, but I've got questions about this one. Can you hang on? Have you got enough time? And can you stay secret and secluded long enough to... Good.
Will you give me a note for my meeting?
Yeah, absolutely. And we are here at the prestigious and distinguished Limbaugh Institute for Advanced Conservative Studies. Now we rejoin Stacy from a secluded, unknown location in Georgia. She is an expert in the health insurance business. She does not want to divulge her location because her industry and people in it have been demonized. And we were in the middle of a conversation on a decapitation of doctors. And I want you to start again on that.
All right,
because this is about bundling.
Yes, capitation. Folks who had HMO plans back in the 80s and early 90s will remember this. Capitation is where a doctor, you have to sign up with a primary care doctor. Your doctor submits a report that says, I have 100 people assigned to me as my primary care people.
Submits that to the HMO?
Yes,
right.
way back. So the company, or in the government's case, the government would pay that provider X amount of dollars, say $10 per patient per month, regardless of whether he sees them or not.
And regardless what it costs him to treat them if they need it?
Exactly. So,
will you explain something to me?
Yes, sir?
I don't know how that ever survived. What doctor worth his salt would put up with that deal?
Well, the thing is, we can promote volume using that. I mean, if you only have 100 primary care doctors in a 200,000-person area, you get volume. So it's the Walmart deal for medical doctors.
Okay, so this is what Obama's talking about. We're going to change from quantity to quality.
But now here's the thing. Capitation also involves how many times a primary care physician has to refer a patient to a specialist. And his payments are reduced when he has to do that. So a doctor has.
Hey, now wait! You're a great source of information, and I got questions sometimes. So pardon my interruptions, but I just want to make sure I heard this right. I understand the capitation, and 100 patients get paid $10, whatever it was, whether they see it or not. But if a patient needs to be referred to a specialist for a test or something based on a diagnosis, then the payment of $10 is reduced.
Exactly. And it depends on how they want to do it, if they want to do it as a percentage, as a flat line fee. But that amount of capitation will be reduced.
Okay, now, does that incentivize the doctor not to refer people who should be referred?
It not only incentivizes that, but it also incentivizes the doctor not to see patients. Because if he brings a patient in and it costs him $50 to do a visit and he's only getting paid $10 for that visit,
well, see, that's
he's losing.
That's what I'm saying. But how can he refuse? The patient needs to see the doctor. Patient calls, I'm coming in. How can the doctor say, no, screw you?
Well, yeah. I mean, they say, well, it's a 3-week wait. If you've got the flu, it's over. If it's anything other than a serious condition, it's gone in 3 weeks. The things people go to the doctor for, the hangnails, the flus, the colds, it's over by then. And now remember, you also in the 80s and 90s had a younger population structure. There weren't as many elderly people with the chronic conditions. You didn't have the diabetes issues that you have today. You didn't have a lot of these things that are building now.
Why not?
Well, because the population as a whole was younger.
Yeah, but type 2 diabetes, I mean, you mentioned that type 2 diabetes can happen when you're 25.
Well, it can, but it's more common the older you get. The same thing with arthritis, the same thing with cardiac problems, the same thing with all these type of illnesses and conditions that come with getting older are going to necessitate more visits with more procedures. It's just, it's an average. It's statistical.
Okay, now I'm going to tell you why this is so valuable to me. Your information is because I'm very fortunate. I don't use my insurance when I need to go to the doctor, and I have not been to the doctor in, 2 years. I just don't go for a flu, for the cold. Last time I went to the doctor was when I held out. I had some intestinal thing, and I held out for 3 weeks. I just don't go. I don't like it. I'm not paranoid. I'm not a hypochondriac. I just don't go. Now, people say, you're getting older, you need to go get checkups anyway. You do these colonoscopies, PDAs, the prostate stuff. I got that handled. But, so, this is all, the story you're telling me, I mean, my first question is, what doctor would put up with this? Like I said, it was the Walmart model until the population demographics changed and the procedures. Remember, in the 80s, we didn't have the blood tests, the MRIs, the CAT scans, all these things that we do now. I have heard doctors complain, everybody, because of sports stars getting MRAs 25 times a season, more and more people come in with a sprained knee, want an MRI. Sprained knee, want an MRI.
About what you said on Greta's show, too, about the major medical, about catastrophic, the HSAs with the high deductible health plans is an attempt to get back to that. The federal government and state governments have basically outlawed catastrophic coverage. The HSA with the high deductible health plan is an attempt to get around those rules where the patient still pays for the doctor's visit.
HSA is a health savings account for those of you in Rio Linda.
We would love to sell major catastrophic. We would love to do these things, but we can't. The law won't allow us to do that. So the quality part will be how many times does a doctor send a patient to a specialist, or how many times does a patient end up in the ER with some, condition, and he will be penalized based on those counts. And that because all of your medical records are now in Washington, D.C., they can track this with precision accuracy.
Yeah. All right, now, by the way, am I also right when I postulate that for Obama to judge doctors' work on a quality basis rather than quantity, somebody in Washington is going to have access to everybody's medical records to find out how this patient's being dealt with and treated, right?
Oh, absolutely. That's the first step in digitizing. That's why they want to digitize everyone's records.
All right. Now, the next question may be a toughie, but